Hi, Video Diary. You may recall that my sleep consultant prescribed me um, an anticonvulsant medication to try and reduce my restless legs at night time to help me sleep. Um, I think I said in a previous um, diary that I tried taking the drug. It was called pregabalin or something, but it seemed to wipe me out. It was knocking me out um, for days at a time. I was going to bed like 48-hour periods, um, so kind of a bit too effective maybe. Um, anyway, I revisited the sleep consultant a couple of weeks back um, to chat about it to say this was the effect of the drug that they'd given me. It's an anti-epileptic drug, anti-seizure drug. Um, I think I felt for like the first week or so of taking it, it seemed to help. I seem to have, according to my sleep tracker, my Fitbit, I seem to be waking up less frequently at night, and felt I was sleeping better. So at the beginning it was great, but then that seemed to, I seemed to have to struggle after that. Um, so the consultant feels that it's still worth trying continuing with both the approach, using an anti-seizure drug, um, and also the actual drug itself. She feels I seem to tolerate it, but going to try and at a lower dose. So she's basically prescribing the same drug but at a much lower dose to try. Um, um, and I'm going to let them know how I get on with that. And if I still have the same effect, what they'll do is they'll try me on an alternative drug to that one, and still an anti-seizure drug to try and stop to keep my legs still at night time. Um, the only fiddly thing about it is that the drug they were giving me the smallest pills they do. To actually have a lower dose, they prescribed me the liquid form, and suggested recommended I get some syringes and to use to take out, so I can take out sort of 10 mil or something um, as a smaller dose. So anyway, I've got an appointment at my GP in a few next week um, to talk about how the best way to get the syringes and the liquid form of this drug. So I'll let you know how that goes. Uh, Another interesting thing is you may recall that about a year ago I was involved in a lumbar puncture study for some HD research. The research team, the multi-site research team that are led by I think Dr. Ed Wild, who's my neurologist, um, based in National Hospital for Neurology in London. What I was going to say now. Oh yeah, so they were basically sampling um, the cerebral spinal fluid in HD patients and measuring levels of chemicals in their biomarkers, such as the level of the Huntington protein, and using very fine, very sophisticated methods using lasers that enable them to measure individual molecules of the protein. So it's never been done before for Huntington's disease, I believe. Um, and that study's going very well. So in fact they're expanding it. They found they're very successful. They've expanded the study, so they're recruiting additional patients now. It's kind of going into the next phase, um, and also people like myself who were involved the first time round. They're studying those people over time. Um, so I basically, after a year, they got in touch with me and asked me to if I would like to participate in this next stage to have my cerebral spinal fluid taken again. Of course, I'm happy to participate. So yes, I'm having my CSF sampled via spinal tap That's occurring in a couple of days. I'm going to the Leonard Wolfson Experimental Neurology Centre in London, which is where they're doing clinical trials for neurodegenerative diseases such as Huntington's disease, and I'll be measuring that. So that's very good. I mean, this kind of study um, is really important. So there are quite a few um, drugs and technologies getting very close to human clinical trials for Huntington's disease and various gene silencing approaches using things like RNA interference and antisense oligonucleotides to silence the mutant HD gene or the protein synthesis um, process. Um, I'm lost again. What are we doing? Oh yeah. So in order to be able to measure the effectiveness of these potential drugs and treatments, you need biomarkers that you can study reliably and predictably, so you can see whether a drug is having the intended effect or not. So yeah, there's things like this CFS study are critically important for that reason, and I'm of course more than happy to oblige because well, my life literally depends on it, doesn't it? So um, yeah, so that's it. So yeah, so a couple of things on. So I'm going to the GP next week to get the new anti-seizure drug, or the liquid form of the drug to try taking that again. That's important because obviously I don't sleep very well. And in a couple of days I'll be having a spinal tap, lumbar puncture, at the very flash Leonard Wolfson Centre in London. Looking forward to that. Sure, I've got some other things going on as well, but I'll update you then.